Good evening, guys. I have a bonus one for you. Discussion E is dealing with a parent's death. Having more siblings was linked with smaller increases in psychotropic medication use after a parent's death, especially after a mother's death, according to a large Finnish registry study. Only children showed the largest rise in medication purchases in the year after their mother died. What the study found: quick facts. Population studied: Finnish residents aged 35 to 55 between 2006 and 2016 using national prescription and registry data. Sample size 1,368 619 people for analysis of mother death. $1,041 $981 for father death. Outcome measured: purchases of psychotropic medications, antidepressants, anti-anxiety drugs, sedatives, sleeping pills, 3 years before to 3 years after a parent's death. Key result: medication purchases rose in the year before a parental death and peaked the year after. The increase was largest when the mother died and largest among people with fewer siblings. Magnitude: the probability of medication purchases was 5.1 percentage points higher for only children in the last year after their mother's death, compared with only children who did not lose their mother that year. The increase was smaller for those with one, two, or three siblings. 4 to 3, 3 to 5, and 2 to 6 percentage points respectfully. Interpretation and practical takeaways. Possible mechanism: siblings may provide emotional support, shared caregiving, and practical help, buffering stress and reducing the need for medication. The study is observational, so it shows occasion association, not proof of causation. Context for midlife grief. Losing a parent midlife can challenge identity and well-being. Grief often endures and reshapes life goals. Social supports matter for adjustments. Limitations to keep in mind. Population and setting. Data come from Finland. Family structures, healthcare access, and prescribing practices differ across countries, so results may not fully generalize to the US or Meadville, PA. Proxy outcome. Medication purchases are an indirect measure of mental health. They reflect prescribing and help seeking, not symptom directly. Unmeasured factors. Sibling quality, geographic proximity, pre-existing mental health, and family conflict were not captured in prescription registries. If you or someone in Meadville coping with parental loss, practical steps: lean on siblings and family where possible. Even small check-ins can reduce isolation. Consider professional support. Talk to a primary care clinician about symptoms. Ask about counseling or bereavement groups. Medication is one tool if symptoms are severe or persistent. Medication plus therapy can help. Decisions should be made with a clinician. Quick guide to next decisions. Decide whether you need immediate clinical help. Insomnia, suicidal thoughts, inability to function, if not urgent. Try siblings, family conversations, local bereavement groups, or short-term therapy. If considering medication, consult your primary care provider or a psychiatrist to discuss risks, benefits, and alternatives. Grieving. This is the second part of E, guys. Title is Grieving with Siblings is often helpful but also complicated. Lean on shared rituals, clear communication, and boundaries to stay connected. If conflict, prolonged distress, or safety concerns arise, seek professional bereavement support. quick guide, decisions, questions, and next steps. Key consideration roles each sibling will take, how you will share practical tasks, how to handle old family tensions, and what support you need, therapy, medication, support group, clarifying questions to answer together. Who will manage funeral logistics? How often will we check in? What topics are off limits? Who needs space versus company? Immediate next steps. Schedule a short family call to align one or two concrete tasks. Set a weekly check-in. Agree on one shared memory ritual, photo album, playlist, meal. How siblings help and why it can go wrong. Why siblings buffer grief. Shared memories, practical help, and emotional validation reduce. Isolation and distribute caregiving. Why conflict appears. Grief reactivates old roles. Peacemaker, caretaker, avoider, differing expectations, and unequal emotional labor. Expect differences. Not everyone grieves the same way. Practical communication tools to use with siblings. Set short, clear agreements. Who handles bills, estate tasks, and funeral details? Write them down. Use I statements to reduce blame. I feel overwhelmed when, rather than you never. Concrete boundaries. Agree on topics that are triggering and when to pause conversations. Rituals and memory work that help. Shared rituals, weekly calls, memory boxes, rotating visits to the grave, a shared playlist help maintain connection and honor the parent. Pick one simple ritual to start. When to get outside help. Risks, limits, and red flags. Seeking professional help. If grief causes severe insomnia, suicidal thoughts, inability to work, or substance misuse. Consider family therapy when sibling conflict blocks potential or practical tasks or deepens wounds. A grief counselor can teach communication and coping skills. Limitations. Siblings can't replace professional care For clinical depression or PTSD, medication and therapy are valid options when symptoms are severe. Practical resources and how to find local help. Start locally. Contact your primary care provider, local hospice organizations, or county mental health services to ask about bereavement groups and grief counselors. National resources for sibling grief and family guidance include St. Jude's bereavement materials and Courageous Parents Network for family-focused support. Okay, guys, that's your extra E for the night. I'll be back on tomorrow for shows. For now, Gator Wellness, take care, folks.